This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery. We're always looking for new ideas and topics from our listeners, so please reach out, share your ideas. You can email us at sg2perspectives@sg2.com or connect with us on LinkedIn or Twitter, and you can find links to all that in the show notes. Now, on to this week's episode.
Hello and welcome to Sg2 Perspectives. I'm your host, Kelly Richard, and today's episode is a continuation of last week's discussion on disruptors with our foremost thinker on innovation and technology, principal on the Intel team, Henry Soch, our virtual health expert, Senior Director, Chris Pagano, and our medicine and surgery service line lead and resident scientist, Director, Justin Cassidy. I've heard all of you sort of mention this along the way. Henry, you talked about how data is collected and how research is done. We talked about crowdsourcing data. We talked a little bit about how, Justin, that the networking that patients are actually doing themselves in that COVID-19 long hauler group. They're creating their own research studies. So it's really important that we're able to glean insights from and apply those insights of data and also figure out technologies that will address the issues that we're finding within that data. So let's start on the data side and really talk through the innovation that we're seeing, but also some of the issues that might be taking place. Justin, let's start with you.
With the data, remember, and it's so important because everything is continuing to change so much that we think we know about this novel virus now, but what we thought we knew may not actually be as relevant moving forward. So those research studies we talked about at the beginning, how many of those are still relevant with the new viral variants in terms of their increased transmissibility and perhaps increased risk of severe COVID-19 that may require some degree of reevaluation? That, coupled with the fact that we know that we've been essentially overwhelmed by dashboards in 2020, all of this data is kind of barraging our attention and sort of deflecting that from what might be the more important things to plan and build for. All this amazing innovation has been really centered on tertiary care in the ICU and ED triage, but we really need to build backwards and think a little bit more preemptively about the patient journey as we've been using these dashboards to really think about the fast surge of COVID-19. We think that it's essential to translate it to the slow surge of chronic disease and to address underlying systemic inequalities to promote health equity. And so a couple case studies that we have that we're really excited about. The first is Parkland Health and Hospital System, along with the Parkland Center for Clinical Innovation in Dallas, Texas. They have been essentially doing geomarkers 2.0, hotspotting 2.0, where they take patients not only zip code, but block by block, determining where chronic disease is in the population, as well as where incident COVID-19 infection is, in order to proactively reach out to individuals that are on that particular block that may be at increased risk of severe COVID-19. This sort of approach is essential to deliver the innovations that we're seeing developed in clinical labs, namely the monoclonal antibody therapies that require a little bit more proactive administration in order to be useful to avoid hospitalization in the first place. The other that we're seeing, and this goes above and beyond COVID, but University of California Health is tracking not only the drug efficacy, that is during a clinical trial, but the drug effectiveness in the University of California Health system in order to really determine what drugs in real world data are effective for what patient cohorts. And this is going to open up all sorts of new innovative business models and opportunities to really cut costs and also improve care by decreasing side effect burden and making sure the right patient gets the right drug at the right time.
The other part here is we're thinking through data. What I find myself thinking about is the idea of the patient journey. One of the things that we've seen come out of this situation with COVID is that a lot of the gaps that we have within healthcare have been identified by a lot of these non-traditional entrants, large tech firms, Walmart, Walgreens, CVS, all of the minute clinic type of organizations, those retail clinics, and then the virtual health vendors that we talked about earlier, right? So American Well, Teladoc, MD Live, I mean, they're just sort of an endless list. They have all accelerated their efforts of coming into the landscape here. Increasingly, what we're going to start seeing is patients who are really receiving care at a multitude of different virtual and in-person sites. The landscape's becoming more fragmented, and it's going to place a pretty significant burden on a lot of organizations to be able to track where those patients are going throughout the ecosystem. And one of the ways to do that is through data. Justin, to your point earlier about we sort of have this onslaught of data that's coming on. How do we manage it? The answer is not abandon the data. The answer is we have to leverage other technologies like artificial intelligence. We have to leverage different types of data management capabilities, and overall an ecosystem approach towards implementing new technologies to translate that data into actionable insights. And the data can't just be from what's within your system, although that's important. It has to also be able to incorporate data from other organizations where your patients may be going, because that's going to ultimately impact what those outcomes look like and also how you should be delivering care as well. We're kind of reaching an interesting point here where the data really kind of flows in parallel to where the patient's going. How you tap into that data, how you utilize that data is going to start to create some points of differentiation between organizations that are going to be successful in the long run and those who are going to run into some challenges here. So this idea of data, it's not as simple as just what's in your EMR. It's a much more complex discussion there. But if it's done well, it's going to spark a lot of innovative partnerships. It's going to create opportunities for organizations to investigate and perhaps adopt new business models and even be entering into new markets that they never would have historically. So really can't understate the true value of what this data is going to look like moving forward.
I'd maybe add to what Justin and Chris have already said. The thing about the data element is this move away from a retrospective look at data. We collect the data for the last 6 months and we kind of try and plow through that, do the analysis on it. What the pandemic has accelerated now is the need to be able to look at that data in real time. The effort to look at that data in real time, apply technologies like machine learning and artificial intelligence to surface issues that need to be looked at in the data. That's a change in the way our members and our health system providers tend to look at data and tend to use data. To Chris's point, what that fosters and what that has done from a disruption perspective is increase the level of importance of organizations like Amazon and Google, who are deep into the machine learning space, deep into the look at large data sets and how do we mine those. And we just heard this week that there's a partnership happening with data acquisition to kind of pool a number of large health systems around the country to anonymize that data, to be able to use that data set to see what's happening more longitudinally with the patient. And I think we're going to see more of those. And I think that you see the two leaders of both of those organizations, Google and Amazon and Microsoft, all the CEOs of that organization are cloud people. I think it reinforces how they're going to approach this as well. This change from retrospective data analysis to on-the-fly, real-time evidence-based data analysis is something that our members need to be aware of and to participate in.
I think you've now coined the phrase cloud people, which I'm going to start using regularly, but that's an excellent point. It's just the idea of being able to take the insights you get from data and apply them immediately and start creating interventions, which we've absolutely had to do. It's been a matter of life and death to do so.
And you can see this happening too in other countries. UK, National Health Service, is doing this incredibly effectively. There's a reason that the new variant is called the UK variant, because they're doing that genomic surveillance and they're analyzing this data in real time. And the other is the World Health Organization pooling together 405 hospitals in 30 countries for their Solidarity trial in order to determine whether or not these antibody infusion therapies are actually effective. It's really important to continue and get a pulse on that, learn from these large consortiums. And as Henry mentioned, we're going to see it here.
And I think the other point, Kelly, we talked about it before, the contribution of patient-generated data. The idea of the social networks of patients who are COVID patients that have had the vaccine. We've seen that before in sites like Patients Like Me, where you have patients that are all experiencing the same disease, sharing what treatments worked for them, what the issues were. We're starting to see on social media patients that have been vaccinated and have gotten their second vaccine from either Moderna or Pfizer, identifying, okay, I didn't have many side effects in dose 1, but dose 2 hit me pretty hard. What was that like and what should you expect? I think the patient contribution to that and that sharing of crowdsourced stuff at the patient level gives us a unique opportunity to kind of get at that patient experience without having to wait for the patient to come into the doctor's office and describe their symptoms, which they usually can't do very well because it's already been a long time ago. The importance of adding that patient level data to the mix, I think, is going to help us a lot in the long run.
Just to wrap us up here, I want to do a really quick hitter to end our session here. So maybe a sentence or two from each of you. what do you think are some of the most disruptive forces that you're seeing that maybe our listeners aren't currently paying attention to that they should be? Henry, let's go with you first.
Okay, I'll give you two quick ones, and it stays with the data theme. Data as a strategic asset. I think that's going to become important for our members going forward. The realization that the data that resides within all of your information systems are a strategic asset to your organization, both for building out new care delivery models, as well as for managing large patient populations in the future. And then I don't want to preempt Chris, but I'm going to add cybersecurity to that. If you accept the fact that data is a strategic asset, that makes it attractive for people to try and get it. And so cybersecurity is important.
Great. Chris, let's go to you since I think there's going to be a segue here.
You know me so well. I've been kind of ringing this bell now for a while. Look, the vulnerabilities that all of this data creates are very real. So the reality is that the more that we have different types of digital endpoints throughout the community, kind of being able to deliver care wherever the patient is, which is where we're going. The other side of that coin is all those vulnerabilities can be accessed by different types of perhaps illegitimate actors, we will say. I mean, the reality is this: cybersecurity is exceptionally important. This is not something where it's a random person looking to do hacking. We have state actors. We have Russia, China, who are known to be coming into this space, who are targeting healthcare and who are getting into hospitals and health systems and who are taking data. We've seen it be applied to ransoms. We've seen that data end up on the black market where it is exceptionally valuable. I mean, really incredibly valuable. And it's a true vulnerability for organizations because the reality is we have not invested historically very well around security. This can have a dramatic impact in terms of patients' impression of the organization. If you are not able to secure that data and keep that data private, over time, it will start to impact what your strategic opportunities are and frankly, what your standing with patients will be. I just can't overstate how incredibly important this is going to be moving forward.
Justin?
Piggybacking right off that, Chris, genetic surveillance. It's coming, it's here, it's super cheap. When we travel, when things reopen, when that vacation happens that we're all hoping for, and you travel abroad, you're going to get a COVID-19 test. Is it taking your DNA as well? And who's going to be using that information? That's number one. Number two is also the threat of international care becoming a destination. If you're offering services virtually, what's stopping patients from just logging online, doing a virtual visit with the provider in another country and gleaning from their expertise? Information hygiene, incredibly important. We've all seen the deplatforming that has happened and the increased power that social media is going to have moving forward as it grabs our attention, as we all know. What does that really mean moving forward? And how are we going to convey information, especially amongst a really super savvy public that's been upgraded with consumerism activities? They think they know what they should be getting for care. How do you really address that in the clinic? And finally, the biggest surprise for me in 2020, and I think what we're going to continue to see in 2021 is the fact that, quote unquote, all pandemics are political. And we might see a political end of the COVID-19 pandemic before we do an epidemiological one. How do health systems manage amidst that really kind of messy state as things are reopening? And what are those rules? I think they've been unwritten.
Fantastic points, all of you. I'm sitting here with the best brains in the biz. So thank you all for coming on the podcast, and hopefully we'll be bringing you back on soon.
Thanks so much, Kelly.
Thanks, Kelly.
This concludes our two-part series on healthcare disruption. This has been another episode of Sg2 Perspectives. If you like what you are hearing, please subscribe and don't forget to rate and review. We'd love to hear from you. Please connect with us on LinkedIn or Twitter at Sg2 Healthcare. You can also reach us via email at sg2perspectives@sg2.com. Reach out and let us know what healthcare trends are most important to you. Please also listen and subscribe to our colleague, Dr. Tom Villanueva's Modern Practice podcast on Vizient's Medical Leadership channel. Tom discusses key healthcare trends through the clinical leadership lens. You can find it wherever you listen to podcasts. Thank you for listening.